Now, RSV vaccine is now available on the maternal vaccination schedule, which I think is excellent. Today, I'm joined by Dr. Linny, who is an infectious disease paediatrician and knows all too well about the dangers of RSV when it comes to our little ones. Now, when you fall pregnant, you've probably heard a lot about what to expect, but not so much about RSV. We were out on the streets chatting to so many people, and it was quite interesting to see that a lot of people weren't quite familiar with RSV. How much do you know about RSV?
I think I'd probably know the same as an everyday punter. I try and keep updated with things online.
I don't know what is RSV.
We're very thankful that we haven't personally experienced it. We have had daycare friends that have been through the ringer.
She was actually in hospital for 5 months when she was born. She was born preemie. Any kind of RSV vaccine she was offered, she was given.
Dr. Linny, I would love for you to share a little bit about RSV and what it actually is.
So RSV firstly is a common respiratory virus. We tend to see it during certain seasons of the year, so generally kind of mid-April to about September. What we see in the hospitals is that lots of young children get hospitalised with RSV, so they get bronchiolitis because of inflammation in their airways, and unfortunately little ones, in particular those who are under 6 months, can have difficulty breathing from RSV. Yes, it might seem like a little bit of a runny nose or a cough to some people, but certainly those people who are at risk, which are generally our babies, can become quite unwell with RSV.
What is it about the RSV symptoms?
If you think about young babies, they have smaller airways, they have smaller everything. Yeah. And because of the inflammation, you're basically decreasing the amount of airflow, and so that's why these little babies struggle with RSV, because things are getting a little bit tighter and it's harder for them to breathe, which means it's harder for them to feed. It can be quite distressing for a new parent to see their kid struggling to breathe like that.
You know, chatting to people that are talking about maternal vaccinations, there's a lot of appointments, there's a lot of things that you have to remember during pregnancy. When should we be getting the RSV vaccine?
With vaccines during pregnancy, we generally recommend them around about the same time. So the same time that you're getting the whooping cough vaccine or the flu vaccine, so between 28 to 36 weeks is when we recommend the RSV vaccine. This essentially gives the body enough time to produce antibodies and then be passed on to the baby via the placenta, which means that baby is protected from birth. It's a really good, easy, safe, effective way to protect your baby from another of the many infections that they might be presented with once they're out in the big bad world.
Yes, and of course, if you ever have any questions or concerns, it's always best to speak with your healthcare provider. The RSV vaccination is available on the National Immunisation Program, and of course, you could always visit health.gov.au.